Hi, I'm Dr. Jeff Thaxton with Stewart & Thaxton Plastic Surgery. I wanted to show some of the latest technology that we have been acquiring so that we can offer our patients the full gamut of things that are available, from minimally invasive and non-invasive treatments all the way up through surgery. And one of the devices that we have fairly recently acquired in the past year and a half or so is the Thermi device. So I'm here in our Coolsculpting and Thermi room to show you what this does. Thermi is a device that has a lot of high-tech instrumentation, but ultimately what it does is it uses radio frequency energy to heat shrink tissues, basically. And it does this. This is the generator that generates the energy, and this little tiny probe is what it delivers the energy with. And what it does is that it is used to stimulate collagen production and to sort of heat shrink the collagen that's present. This generator has a temperature on it that we can set up to about 65. We can raise that to 70 if we're wanting to go a little bit deeper, or if we're just under the surface of the skin, down to 60 degrees Celsius or so. And once we set the temperature, the machine won't let us deliver more energy than we'll get to that temperature. And this probe has a thermometer on the end of it, and it tells us the actual temperature that we're getting to. We want to get it close to 60 degrees, maybe up to 65, to have the maximum effect we're going to get on the collagen. While we're doing that, there is an infrared camera that is monitoring where we're working on the skin. And this camera basically monitors temperature, and the computer will tell you where the highest temperature is. So what we're doing, when we first get started, this is a bag of cold saline, and it shows up purple looking. And this is a bag that we have heated up, and it will tell you its maximum temperature. Actually, it's cooled off now, so it's still cooler than my neck showing on the screen. So the maximum temperature anywhere on the screen is 36 degrees. We try to keep the surface temperature under around 45 degrees Celsius to prevent any blistering from happening. With this camera, it's pretty easy to keep track of where we're going, how much we've heated up everything. So when we're heating up collagen, the idea is that collagen is a helical molecule, and when you heat it up, you denature it and it actually shrinks in length. And once it's done that, your body recognizes, oh, that's damaged collagen, I need to replace it. So not only do you get that immediate shrinking from the heating up, but then your body says, I need to start producing more collagen, and you get some thickening of the skin. And how that works, I tried to come up with a prop that sort of shows you what we can accomplish. And you can imagine if this is the surface, if this is the skin, and we're running a probe through a little incision. What did I do with my probe? Through a little incision, we go underneath the skin and run this underneath to stimulate the collagen. And underneath, right now, this is representing youthful skin. As we age, some of this collagen starts to shrink or starts to get loose, and it gets weak, and then suddenly the skin's getting wrinkles in it, and it doesn't have quite the elasticity. Once we run that probe back underneath, then we've re-stimulated this collagen, and it's gotten tight again, and now the skin's looking more youthful. So that works. The nice thing about this, there are other devices that work on the surface, and they work to stimulate that collagen that's going across the top. But Thermi, the uniqueness about Thermi, and other devices will do this to a lesser degree, but the very nice thing about Thermi is that when you go underneath the skin, you can go just right underneath the surface and get that tissue. But you can also run the probe a little bit deeper between the skin and the muscle underneath, or the bone underneath, or whatever the solid structure is underneath. And you can actually heat up these collagen fibers that are going sort of north and south to the skin, to the underlying surface, and you can actually pull things back down, which, in my opinion, really makes a huge difference. And the reason it does that, and I have a couple of pictures of some arms that I have done, and these are actual patients of mine. This is an arm, as you can see, had a significant amount of laxity and sagginess there, and what some people refer to as bat wings. And after doing the Thermi procedure, which consists of making a tiny little 1/8 of an inch incision here and near the elbow, when we basically run this cannula underneath, and as you can see, a couple of months later, her arm contour is drastically changed. You can't really see it in these pictures, but in addition to the contour improvement, which I think is very obvious, the texture of her skin, she no longer has the crepiness, the loose looking texture to her skin. It doesn't show up well in the pictures, but you can see it. I have another picture over here. This person wasn't quite as lax to begin with, but as you can see it a little better in these pictures, the texture of the skin has improved considerably. And this is very early on after the procedures. Actually, you can still see where the incision was made. So, in addition to doing arms, for the most part, skin is skin. So we have the ability to do this procedure wherever someone has loose skin or skin texture that's getting a little bit wrinkly, maybe some sun damage. So this can be done on the face, on the neck, arms, thighs, abdomen, the gluteal area, and have some improvement in any of those areas. The reason I showed the arms is because the arms with that loose bat skin really shows up well on the camera. However, the area that I've done the most of is the lower face and the neck. And for the most part, the patients have been very pleased with the results. There are some people who've said, well, I wish it would have done a little bit more. And I think that gets into where the experience is. You know, if you're somebody who has a great deal of laxity and you come to somebody who has a Thermi device but doesn't have the ability to do a facelift or something, you're going to get a Thermi, and you're not going to get the results you're looking for because you just weren't the great candidate for it. For here, I have this available if you're a great candidate for it. But if you're somebody who I look at and say, you're going to get probably some result, but in my opinion, based on what you're asking and our interaction, I think you're going to need something more than that. I have the ability to offer that.
I have a question.
Okay.
So, what's the difference? Is this similar to what, like, say, a cream would do for the face and neck? Because you said it works on the face and neck.
Well, creams are great, and they run the gamut from sort of maybe non-effective, just covering up problems, to sort of medical grade creams and lotions that can make a significant improvement in the texture of the skin. They still, ultimately, even the best of creams are a little bit limited in that they're going to penetrate a millimeter or two at best, and they're going to get some improvement there, but they don't have the ability to actually pull that tissue back up to the underlying structures.
Thank you. Any other questions?